So our next presenter is Dr. Rakhi Kushumesh. Yeah. She will present on understanding keratitis in Bihar, epidemiology and microbiological perspectives.
Okay, good afternoon. Yeah, the slideshow is not running. Okay, I have no financial interest in this subject matter. So as we all know that microbial keratitis is most common non-surgical ophthalmic emergency, and so knowledge of the specific regional epidemiological factor is really important to diagnose and treat the disease timely. So there are many studies from South and North India, but very less from the eastern part. And more of the study has less number of patients and none of them from Bihar. So it is underreporting, causing underreporting and underestimation of the impact. So this study was done to determine the demography, risk factors, and the causative organism of the microbial keratitis in Bihar. For this, we conducted a retrospective study from 2019 to 22, and we included we actually reviewed the medical records of all clinically diagnosed patients with microbial keratitis, and we excluded the cases with suspicion of herpetic infections, neurotrophic ulcer, autoimmune keratitis, in which the data was incomplete, and who had endophthalmitis at the same time. And IAC clearance and informed consent was available. So in history, we collected the duration, onset, risk factors, and prior use of any medication, especially the topical steroids, contact lens uses, or any ocular status prior to the surgery and systemic condition. In clinical examination, we took the all parameters like size, shape, perforation, IOP, and hypopia and everything, and the record of smear and culture positivity. And in bacterial isolate, we collected data from antibiotic susceptibility. So we also did a statistical analysis, requires a statistical analysis, including the odds ratio. And we analyzed 2,303 cases in which the mean age was 48, majority lying between 31 to 40, and with male preponderance. 73% of patients belong to rural area, and so agriculture activity. The duration of symptoms prior to presentation, 63% patient presented after 2 weeks, and 20% after 4 weeks, and very few patients within the week. And why it was so? Because 94% patients have already sought some medical treatment from the chemist and non-ophthalmologist, and majority have been given antibiotics alone, and 30% of them were given the combination of antibiotic and corticosteroid in form of Ciplox D, and there are various brands. Mean duration of uses was 3 days, ranging from 1 to 9 days. In clinical profile, 51.4% patient presented vision was less than 660. Mean size of ulcer was 5 millimeter, and 14% patient presented to us with corneal perforation and 5% with impending corneal perforation. So if you look at the profile of patients' clinical picture in the patient who have used steroid before, so you find that the mean age was less, mean duration of presentation was long, and the epithelial defect was quite significant than the other patients, and they all presented with, majority of them presented with perforation, so required surgical intervention immediately. In causative organisms, smear positivity was definitely, it was more than the culture, and the causative, most common causative organism was fungi, followed by unidentified. In organisms, in isolates, we have Staphylococcus and Streptococcus sensitive to the linazolid, gentamicin, and other fluoroquinolones. In gram-negative, Pseudomonas and Klebsiella were the predominant, sensitive to the fluoroquinolones, aminoglycoside, and colistin. And in fungi, Aspergillus and Fusarium. Risk factors were same as the other studies, like most common predisposing factor was trauma. And in bacterial keratitis, the coexisting ocular disease was the main factor, and systemic condition diabetes was common in all. So similar to other studies, we had also the male preponderance. Most common factor was ocular trauma. Fungal keratitis was the commonest, and the smear positivity was more with similar profile. But what was different in this study, that we had majority of the cases presented to us after 2 weeks. That was delayed presentation, unlike other studies. And the most serious concern was unregulated use of corticosteroid, resulting severe grade of ulcer. Limitation of this study, that it was a single tertiary care center study, so it cannot be generalized to overall all other population and other states. And there was a lack of advanced microbiological examination, resulting poor yielding. Clinical implication, if you could provide the population with early diagnosis or the access to nearest health center and the simple and effective treatment, then definitely it can reduce the severity as well as the corneal ulcers rate, and therefore it will also decrease the need of keratoplasty. So our recommendation, because we have different layer of health, like healthcare services from medical colleges to CSC, PSC and sub-centers. So we can train the medical officers there, we can train the JNM, we can train the ANM there, just to identify the lesion at a very early stage, or if possible, they can start the prophylactic treatment for the ocular trauma, because this was the most common risk factor in this study. And if the lesion is large or if patient is non-responding within 2 days or 48 hours, they can refer to us. Or we can also use some AI. If we could use in the periphery, then it would be beneficial for the patients living far away from the tertiary healthcare center. Thank you so much.
Any case of Bacillus cereus was seen?
Yeah, it was there, but I have not included in the list because I cannot enumerate the whole list of bacterial isolates. It was Bacillus was there. In a polymicrobial keratitis, there were few number of keratitis who had more than 2 organisms.
What was the presentation of Bacillus cereus infection?
It was
Must be a trauma case. This must be.
Yes, because trauma was the most common risk factor in our study. So
what
there
was
was
the presentation
the clinical picture was not entirely different from the bacterial ulcer, because most of them have already used antibiotics. So clinical, just based on the clinical picture, we cannot identify that what could be the organism underlying. So there is no characteristic picture was found in the cases with Bacillus. It was similar to like epithelial defect with infiltrates and the 1/3 or 2/3 necrotic material present in similar to other bacterial cases.
No, Bacillus cereus typical presentations. A ring abscess is there, and this is a very serious infection which can destroy the eye within 24 to 48 hours.
Yes, sir, it's true. But majority of the patient come to us after 7 days, and more than 63% patient come to us after 15 days. So we no longer found this kind of typical presentation of any organism except few fungal cases.